by the noise actually. So the eardrum's beginning to reveal itself. There is going to be some muck here. The patient's been using loads of drops, had water in there, so it's going to be a lot of staining. But I'm going to now, the patient can hear significantly better. The hearing's almost restored. But I'm just going to mop up, and whilst you are, I'll continue to explain about the endoscope. So yeah, you can use landmarks such as that, shadows, and there's also something called motion parallax. Now, motion parallax, the best way I can describe that is if you're on the highway, I think you call it in America, or in the UK, a motorway, and if you're looking at the window, so imagine you're passengers. If you're driving, I want you to look straight ahead unless you're changing lanes, but imagine you're a passenger and you're looking out the window. And if you focus on two objects, if you focus on an object closest to you and one far in the distance, you'll notice the object closer to you, obviously it's moving a lot faster because it's closer to you, but the object in the distance, although you can sense it moving, but it's at a lot slower rate. And motion parallax is using the difference in speed of a moving object, one near to you and one further away. And that provides you the ability to judge the depth. And you can do that with the ear as well. So when you've got the eardrum in view in the distance, and then as you're getting closer, the side of the ear canal walls, like as you're pushing the endoscope further in the ear, you can see a quick change in speed of you entering with the endoscope. Whereas the eardrum, it's less of a speed because it's a bit further away. So you can pick up depth perception like that. Also, when you attach the sucker on the wax, it changes the sound, so that's another method of knowing that you're on the wax, using the wax as a target, and you slowly approach it. So, but it is, again, it's a skill that you just have to master. You have to keep doing it. The more you do it, the better you'll get. So I'm now just mopping up. It is difficult because there's a few hairs here at the entrance again. There's a bit of dead skin at the right hand side of the ear canal. I'm going to peel that away. So the patient emailed us the following day. I'm going to let them know I'm uploading the video. They asked me to do that. They have been waiting about a month, so I do apologise. And they just wanted to thank me for everything we did because, we managed to make them hear again, and it made such a difference to their quality of life. They did report that although they could hear significantly better, on this right side, when they were swallowing, it was kind of bubbling, crackling. So it's very likely that they, and you could tell they've been watching my videos because they diagnose themselves as it could be a bit of eustachian tube dysfunction, a bit of catarrh at the back of the eustachian tube. So recommended some over-the-counter nasal decongestants and some other treatments, and advised the patient to contact me after a week if they're still symptomatic, because if they are, I can write to the GP and have some more treatment prescribed. They haven't contacted me, so I can only assume that they were successful and the symptoms have alleviated. So again, just mopping up the bottom. It's very wet, so just going to hover over it. So this is the bony part. Now, I'm not going to get rid of that speck, and a lot of this is non-significant, and by attempting to remove, we've done such a great job. It's such a complex case, removed so much. Me trying to remove little bits like that, you could potentially cause trauma to the eardrum. And that, you can tell it's been propelled. The water has flushed that bit of, there's a few hairs actually, it's propelled it, jet washed it against the eardrum. So you just want it to dry up. Obviously we dried it as much as we can with the suction as well. Just mopping up near the entrance, you can see all that sticky stuff. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye-bye.